Imagine being told that your child has a genetic condition that causes tumors to grow in their nervous system and could eventually become covered in small tumors on the outside of their body. My sister-in-law had to figure out how to navigate this scary feeling, all while learning how to be a new parent, as my niece was diagnosed with neurofibromatosis type 1, which I will now refer to as NF1. Learning how this genetic condition could affect so many parts of her life was shocking. Many of us know someone living with a medical condition, disease, or disorder, and understanding NF1 helps us recognize how genetic disorders can impact daily life. Even if you have never met someone with NF1, learning about it today may help you support a friend or family member who may go through a diagnosis like this. Seeing my niece navigate this condition has sparked my curiosity, and I researched NF1 to better understand the symptoms, challenges, and how to manage it. Today, I will first explain what NF1 is, and then describe its effects on the body and daily life, and then discuss how to manage it and improve quality of life. Let's start by understanding what NF1 actually is. Neurofibromatosis type 1 is a genetic disorder that affects nerve tissue and the body. NF1 is caused by a mutation on the NF1 gene, which controls cell growth along the nervous system. This mutation can cause tumors to develop along nerves. The Children's Tumor Foundation informs us that usually these tumors are non-cancerous. The tumor can become malignant, but most patients will never develop a cancerous tumor. It can also cause skin changes and bone abnormalities. One skin abnormality it causes are cafe au lait spots, which are light brown patches on the skin and are often one of the first visible signs of NF1. These spots help doctors identify NF1 early and monitor for other complications. The Mayo Clinic states having more than 6 cafe au lait spots suggests NF1. These spots are usually present at birth or may appear during the first years of a person's life. After childhood, new spots will not appear. NF1 also causes neurofibromas, which are soft tumors that can appear on or under the skin. These neurofibromas are usually benign, but can sometimes interfere with daily activities or cause discomfort depending on where they grow and how many grow on the individual. The presence of these tumors are usually unpredictable and varies widely between individuals, which makes monitoring this disorder essential. Now that we know what NF1 is and how it presents, let's examine how its effects overall on daily life. NF1 can impact learning, bone development, and vision. Many children with NF1 experience learning difficulties and attention challenges. These challenges may include trouble focusing in school or slower academic progress. Speech delays and ADHD are common in children affected by NF1. Behavioral issues also may occur, requiring educational accommodations and extra support from family and teachers. NF1 can cause bone and vision problems. Bone abnormalities such as scoliosis or other deformities can occur and require monitoring by medical specialists. Tumors on the optic nerve may affect vision, requiring regular eye routine exams. They are essential for early detection. For my niece, the condition has required both routine medical checkups and adjustments in her school environment, needing extra support. Knowing how NF1 affects the body and learning makes it clear why proper management is crucial for these patients. Management of NF1 typically focuses on monitoring, supportive care, and treatment when necessary. While there is no cure for NF1, patients benefit from regular screenings and checkups. Anyone with this diagnosis should see a neurologist, ophthalmologist, and other specialists to monitor any symptoms to prevent more complications. Early detection of tumors or vision problems can avoid long-term effects and improve quality of life. Supportive care and treatment can help patients manage symptoms. Surgery may be required if tumors can cause any pain or interfere with their daily functions. Families and caregivers need to provide emotional support and help children adapt to their learning challenges and daily routines. My niece's care team and family support have helped her manage symptoms and maintain a positive quality of life. As of now, she has not had very many adverse effects. However, during puberty, it is typically when neurofibromas begin to form on their body. Understanding NF1 symptoms, effects, and management is why awareness of this condition is important for families and communities. In conclusion, neurofibromatosis type 1 is a condition that affects multiple aspects of a person's health and development. Someone diagnosed with NF1 can see impacts in everyday life, dealing with tumors along the nerves, usually benign, can grow large and painful. Skin changes such as cafe au lait spots or small bumps called neurofibromas, and bone abnormalities such as scoliosis. NF1 may also impact learning and attention, as well as vision if the tumors affect the optic nerve. This is why careful monitoring and supportive care help these patients manage their symptoms the most. Seeing my niece navigate NF1 has shown me how crucial knowledge is and awareness are for families and caregivers. By now learning about NF1, we can better support those affected and live healthy lives.